close till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
Now I'd like to demonstrate passing a tube down the nasal cavity of a cow for purposes of administering fluids into her rumen. The reason you might want to do this is that in some cows, particularly sick cows, they have a gag reflex that's very pronounced, and about the time you get a fric speculum or a stomach tube started into the oral pharynx, they will object violently and regurgitate, and then it means that you're unable to administer the medication because it's too risky. In those cows, you get a whole lot less stimulation in the oropharynx by putting the tube, which is of much smaller diameter and also enters by way of the nasal cavity. In order to do that, you pass it much the same as you do in the horse, except that the cow's nose is much more rigid. The cartilaginous tissues, the fibrous connective tissues aren't as movable, so you have to use your thumb to some extent to direct the tube down into the ventral meatus. The cow objects, as you can see here, strenuously for the first few centimeters you pass this tube. And once you get beyond that point, if you're successful, it subsides and the cow no longer objects. Now I've just rapidly inserted it for a few centimeters. We're at a point where she should no longer object. I'm using my thumb here as a guide to help keep the tube medial and ventral, just gently pushing it in there. Now I can feel her swallow. We'll slide it in and out a couple of times. And now it's going easy, so I can tell it's going in the right place. And at this point, the technique is the same as we just demonstrated by the oral route. You can blow on the tube while an assistant listens at the rumen to determine if it's indeed in the rumen and not in the lungs, or that it didn't come back out into the oral pharynx. Another possible advantage is that slightly less restraint and less equipment is needed to administer medication into the rumen. At this point, someone could hold that tube with very minimal tension to keep it from sliding on out, while you have one hand that's more free to be able to do some kind of operation. On pulling it out, you simply withdraw it